Hello there, it is the end of quarter four for Volition RX, so it's time to talk about the full year financial results and business performance. And joining me now is Cameron Reynolds, CEO. Cameron, before we drill down into more detail, just walk me through the highlights for Volition in 2020.
Nick, it's been an absolutely amazing 2020, especially given the pandemic. We've kept our facility open throughout the whole time in Belgium. We've taken care of our team. We've raised a huge amount of capital. We bookended the year, starting with the purchase of Optima, which secured the most key components of our assays, which we can now produce in Silver One. We opened Silver One, the main production facility, which now gives us tremendous flexibility in a very wide range of areas. And of course, we launched our first product, which I'll get to a bit later, and booked our first revenue. So considering all the headwinds we had with the pandemic, the team has showed amazing resilience and flexibility, and we've really performed in all the key areas.
Well, thanks, Cameron. Normally we get you to deal with the numbers, the financial results, but Volition has a new Chief Financial Officer. His name is Terig Hughes, and Terig joins us now. Great to meet you, Terig. Before we go into the numbers, how have you been settling in at Volition?
Thanks, Nick. Nice to meet you too. Well, it's been a fantastic first month. It's a great team here. Everybody's been very welcoming. And there's a lot going on, so I've really had to hit the ground running.
Okay, time to look at the numbers. Just talk us through the financials for Volition in 2020.
We are in an incredibly fortunate position in terms of the strength of our balance sheet. We finished the year with $19.4 million in the bank, as opposed to about $17 million in the prior year. And to give that some context, our burn rate through the final quarter averaged about $1.5 million per month. But we do expect that to tick up a little, given all the activities that we've got going on at the moment.
Okay, thanks for that. We're very much now into 2021, which looks like it's going to be a very interesting year for Volition, but it's already been a busy period, Terig.
Yes, it's been a very busy first period. We've raised a little over $20 million through our equity market offering, as well as our at-the-market facility. And we've been awarded a further $4 million in non-dilutive funding from the Walloon Regional Government and associated agencies. All this puts us in an incredibly strong position to deliver on our future milestones.
Well, thank you very much, Terig Hughes, the new CFO for Volition RX. Going back to Cameron now. Cameron, we've talked in previous interviews about you protecting your inventions. So just bring us up to date on where you are with your IP.
Well, Nick, it's been an absolutely amazing year on intellectual property as well. Our Chief Scientific Officer, Jake, has been locked in his basement writing patent after patent after patent. We have a very wide range of patents, over 60 now granted and 90 pending in a range of different countries and different areas. We really, truly own this space, the nucleosomes in circulation in cancer. We've spent 10 years now developing this platform, and I think our intellectual property is going to serve us extremely well. Now we're a company of products to help protect us, to really drive everything we're doing.
What about the animal side of things? Where do we stand at the moment on Volition Veterinary?
The beta launch for the vet products has gone extremely well. So we've launched now with Texas A&M, and we've never launched a product before. We've never launched a vet product. And no one has ever really launched a cancer product in the blood space for dogs. So this is a really important thing for us to get right. We're trying to fully optimize all the key components, things like feedback from the vets, how the blood is collected, how it's shipped, all the things, including price. Texas A&M ordered the first batch of kits late last year, and already this year they've reordered twice, so it's picking up well. And we expect to use all of this learning to help us to do a national launch. And also the learning's been incredibly useful in our very important discussions with the big multinational vet companies, using them to help really drive product launches and revenue through licensing or distribution. And we're also looking at beta launches worldwide in Asia and in Europe.
Okay, so interesting progression there on the veterinary side of things. Cameron, let's switch over to human cancers, very important to Volition and the rest of the world. Just bring me up to date on what's happening on the human side of things.
The human side has also progressed very well. As we mentioned before, the one downside of the lockdowns is the US colorectal study has been paused. We're hopeful that'll start as soon as the pandemic starts to really recede. We've really moved forward very, very well on the other two areas, the blood cancers. We released some great data last year and announced that we're starting or have started the work on the 510K study to be a pivotal US study for a launch of our assays in non-Hodgkin's lymphoma. It started now. We expect the first readout to be in the next 12 months and then the end of it by the end of next year. So we can then, if that goes well, we could launch that as a product in the US. And that was from learning from the vet space. The cancers we can measure in the dogs are the blood cancers. So it's been a very good back and forth between humans and animals, and we've had excellent results in both. So the 510K study, that's very exciting. And of course, the Taiwanese partners we work with very closely at the National Taiwan University had some great data with our assays in lung cancer, just using it as a companion with low-dose tomography, computer tomography, to seeing if we can help distinguish between the positives, which are the real cancers, and the false positives, which are benign nodules. And from the preliminary data, we have a lot more progressing now. It looks like we could count out 32% of people who had a nodule, a small nodule, but we could differentiate that from the early stage 0, 1, and 2 stage cancers. So at the moment, very encouraging. We'll have a lot more data in the short term. And again, if that's successful, we'll also launch a 510K study with the FDA, like we have in the blood cancers, to see if we can get approval to use that as a product in the US as well.
Interesting to note that all this activity for Volition has been going on against the backdrop of a worldwide pandemic. And Cameron, just bring me up to date on some COVID-19 elements that you've been looking at as well.
Yes, we have indeed. So the main thing that kills you in COVID-19 is NETosis. And we've shown that we can measure that very, very well. And we're looking to see if we can be part of the therapies for it, as also the diagnostic and prognostic. And I'll pass you over to Jake Micallef, our Chief Scientific Officer, to give you the full story.
Thanks, Cameron. It is a really exciting and fast-moving area of science. A lot has been learned over the past year or so, and a lot of papers published in NETs and NETosis, especially in regard to COVID-19. And the background is essentially that many people get infected with COVID and have little or no symptoms. Certainly doesn't make them very sick, and they don't need to go to hospital. At the other extreme, some people die from the disease. And the difference is not really in the bacteria, the difference is in how they respond. And the difference really lies in NETs and NETosis. One of the ways in which the body responds to bacterial or viral infections is to produce NETs, neutrophil extracellular traps, which are made of chromatin, and they can actually catch viruses and bacteria locally and kill them. So NETs are a vital part of the immune system, but if you produce too much NETs, it starts to attack and damage your own tissues. And this is what happens when people have a bad reaction to the virus. The good news for Volition is that these NETs are made out of chromosome material, and chromosomes are made of nucleosomes. And we've been developing nucleosome assays for 10 years now. We certainly have the best nucleosome assays in the world, and I believe we have the only analytically valid quantitative nucleosome assays in the world. And what this means is that we're superbly placed to develop blood tests for NETs and the effects of NETs in COVID patients and in sepsis patients and all of the other diseases in which inappropriate NETs and NETosis is involved.
Okay, data, extremely important. What data have you been able to generate so far?
Last year, we looked at patients who got COVID during the first wave of the disease. And what we found was that patients who were infected with COVID and presented at outpatients, so they're unwell, but they're not very unwell, had elevated levels of nucleosomes and elevated levels of NETs as determined by their nucleosome content. Patients that were admitted to hospital, but to ordinary wards, so these are sick people who definitely needed medical care, had more highly elevated levels of NETs and nucleosomes. And people who were admitted straight to intensive care had very high levels of NETs and nucleosomes in their blood. People who were admitted to intensive care and eventually died had even higher levels than those who were admitted to intensive care and survived. So what we found last year was that the the level of nucleosomes and nets in your blood is very correlated with the clinical features of the disease itself.
So looking ahead, we still have issues of pandemic in various parts of the world. What are the next steps related to COVID-19 from your perspective?
So what we proved last year was that NETs is correlated with the disease, and because it's the primary cause, that's not unexpected, but it's very good news that we were able to show that. What we're showing now is that this works in individual patients. So if you have a high level of NETs, will that translate into a worse course of the disease in the future? So is it predictive as well as correlated? And we're doing these studies with major hospitals in London. We will be reporting those results in the next few quarters.
And I understand you're going to be looking beyond COVID.
Yes, we have looked at other diseases. In particular, we've looked at sepsis, and we've looked at an animal model of sepsis in which a septic shock is induced in animals, and then that sepsis is treated or not in control animals. And we have been able to monitor the treatment in these sepsis models. The treatment itself worked well, and the results showed that our assay was able to monitor the effects of the treatment better than other ways of looking at it, and was also the most practical and low-cost method. In addition, we're also investigating 2 therapeutic antibody drugs designed to treat netosis, and looking at the nucleosome assays, both in terms of monitoring those treatments and in terms of acting as companion diagnostics for the selection of patients for whom such treatment would be appropriate. Overall, it's been a very exciting time, and it underlines the breadth of application of the Nu.Q platform, and we'll be presenting a lot of data at conferences in this area this year.
Well, thank you very much, Volition's Chief Scientific Officer, Jake Micallef. Always great to hear views from such a large and clever scientific brain. Cameron, back to you now. You've got to use your brain now, because 2020 was interesting. What's on the horizon for 2021?
Yes, Nick, it's going to be an amazing year. I think all of our 4 key pillars of the company have made amazing progress through 2020. We're very well financed now. We have a strong balance sheet like we've never had before. We have a fantastic and expanding team, and expanding in areas which are really important to us, to really change the team to not one of just research and development, but one of products. So I think we've done a very good job of that, and expect to see some more key hires in the sales and product side throughout the year. So the 4 key components, you'll see a lot of things happening in the vet space once our beta launches are progressed in US, which will be the first, then announcing what they are in Europe and Asia, and also then hopefully really strengthening the vet team, as well as really progressing the licensing discussions. On the cancer space, as I mentioned, a lot of data coming through, particularly in lung and in the blood cancers. Also, Nu.Q Capture, we've been optimizing that over the past few quarters. We expect to see a lot on that throughout the end of the year. And of course, as Jake so excitingly said, the netosis side has been a little slower during the end of the pandemic in the last few months than we thought, but I think we're doing a huge amount of work, and we'll have a lot of information on that this year. And we're very hopeful we can launch a range of products, not only in the diagnostic, prognostic, but also be a very key part of the therapies for netosis, which I think could be easily as big as the cancers if we can get it all right. So watch this space. I think it's going to be a great year for us.
Well, thanks very much, Cameron. We will very much be watching this space and bringing you updates from Volition RX. But for the time being, Cameron Reynolds, CEO of Volition, and the other members of your team, thanks so much for joining us.